لا 15. واضحة الشاشة عندكم شباب؟ نعم هسه دقيقة. هسه اوكي؟ هسه الشيرينج اوكي؟
نعم دكتور.
بعده اوكي شباب؟ تمام هسه؟ نعم. بسم الله الرحمن الرحيم. Our lecture today is regarding the anterior pituitary disorder after we complete the posterior pituitary disorder part. To study the anterior pituitary disorders, it will be divided, or it will be studied as hypopituitarism, hyperpituitarism, and local mass effect. The hypopituitarism, to start with, is the disorder that is caused by complete or partial lack of pituitary hormone secretion or production. Disorders that is caused by complete or partial lack or loss of pituitary hormones secretion or production. The hypopituitarism is a clinical disorder that is caused mainly by pituitary tumors that can be functioning or non-functioning. Functioning, when we say functioning, this is mean the patient presented with features of hormone loss or not, so that is the tumor secreting the tumor secreting hormones or not secreting hormones with their clinical effect. So the tumors, pituitary tumors, can be functioning or non-functioning in general. So functioning mean the patient presented clinically with signs and symptoms of hormone excess or hormone loss. In hypopituitarism, there is hormone loss or not. That is the tumor not secreting hormones. Shabab, what do you expect the presentation to become earlier, in functioning tumor or non-functioning tumors? تتوقعون the presentation earlier in functioning tumor or in non-functioning tumor?
Functioning.
Yes. Yes, usually the non-functioning tumor present late because the presentation is usually associated with local mass effect, that the tumor will be enlarged and compressing the adjacent tissue, whereas the functioning the patient may present it with signs and symptoms of hormone excess or not. Whereas the other non-pituitary tumors that are primary or metastatic. So pituitary tumors in case of hypopituitarism، هسه نشوف الهايبر والhypopituitarism. Hypopituitarism can be seen with pituitary tumor, that is, tumor grow and destruct the other cell types and result in lack of their hormones. Other non-pituitary tumors from the hypothalamus or brain tumors, glioma or so on, or metastatic tumors can compress or can destruct or can metastasize to the pituitary and causing their loss or lack of their internal hormones. Pituitary surgery, that is any surgery, neurosurgery involving the pituitary for adenoma, for anything, so result in destruction. Radiation will destruct the pituitary gland, result in lack of hormone or hypopituitarism. Apoplexy, that is a term associated with sudden hemorrhage within the pituitary parenchyma, for many causes. The most common one is or can be associated with Sheehan's syndrome, that is postpartum ischemic necrosis. هسه نجي عليها بالتفصيل. Sheehan's syndrome, postpartum bleeding and ischemic necrosis within the anterior pituitary after labor. Cyst or Rathke's cleft, this is a congenital malformation that will result in cystic change, and a syndrome or called empty cellular syndrome. It is not a disease, it is related to can be primary or secondary empty cellular syndrome. In the primary form, there is an anatomical defect above the pituitary gland, increases the pressure in the sella torsica, and this will result in flattening out of the gland, and this condition can be associated with hypertension in women, and it can be a cause for the idiopathic intracranial hypertension. Primary empty cellular syndrome defect or small anatomical defect above the pituitary gland will result in flattening out of the gland. This is the primary, and it can be secondary. The empty cellular syndrome can be secondary. It is the result of the regression of the gland within the cavity as a result of injury, as a result of surgery, trauma, radiation. This is called the secondary empty cellular syndrome. The patient with secondary empty cellular syndrome result in from destruction of pituitary gland. They have symptoms of loss of pituitary hormones like amenorrhea, infertility, or fatigue as a result of ACTH loss, and intolerance to stress as a result of ACTH loss also, and intolerance to stress and infection. Okay, so empty cellular syndrome can be primary as an anatomical defect or secondary as a result of injury to and the regression of the gland as a result of injury or radiation or surgery, with resultant hormone loss according to the affected cells, according to the location of the pituitary gland damage. Okay. Again, I you should know this, you should put in memory that is the close proximity of the pituitary gland, that it is the infundibulum, and to the optic chiasm. This is the optic chiasm, and this is the optic nerve. Know the close proximity and association between the pituitary gland and the optic chiasm and nerve. So mass effect, local mass effect, and visual disturbances and visual field defect are important consequences of pituitary enlargement or involvement or tumor and so on. The defect or the deficiency of the hormone, depending on the site affected, can be panhypopituitarism of all the glands, all the anterior pituitary is affected, result in like in growth hormone deficiency in adult, can be non-apparent, can be compensated, or can be replaced by administration of ACTH or cortisol, or in addition in children it is apparent, result in dwarfism and retarded sexual development. ACTH deficiency and growth hormone deficiency. Growth hormone deficiency is non-apparent in adult and is apparent in children, result in dwarfism, whereas ACTH deficiency, it is a life-threatening. It is result in cortisol deficiency and impaired response of the body in case of stress or infection and so on. FSH and LH deficiency result in hypogonadism in both male and female, amenorrhea in female, and atrophy of the glands and loss of pubic hair, and also infertility in both male and female. TSH deficiency, that is the TSH. What is TSH? It is secreted from which cells, Shabab?
From the hypothalamus.
What are the cells secreting TSH? What we call them? Cells secreting TSH?
Basophil.
Basophils, yes. What are they called?
The thyroid stimulating hormone.
What?
Somatotroph?
No.
Thyrotroph.
رجاء سدوا السبيكر الأصوات اللي يمكم mute yourself please بدون إزعاج. growth hormone cells secreting cells هاي نسميها somatotroph. ACTH producing cells called corticotroph, and the FSH are called gonadotroph, whereas the TSH secreting cells called the thyrotrophs. Okay, so deficiency or damage to these cells result in secondary hypothyroidism. نسميه شباب secondary hypothyroidism. Why we call it secondary hypothyroidism? Because the deficiency is related to TSH secreted by the pituitary, not internal to thyroid gland. مو صحيح? Yes. Tumors of the pituitary gland, pituitary adenoma causing compression and increase intracranial pressure and destruction of the pituitary. Brain metastatic cancer, metastatic tumor, and traumatic injury, shock, and stroke all result in ischemia or intracranial bleeding and result in hypopituitarism. So, Shabab, put in mind that is pituitary adenoma or pituitary tumor can result in hypopituitarism, hyperpituitarism, and local mass effect. كلها متوقعة. Okay, decrease in hormone, increase hormone secretion, and local mass effect commonly seen in non-functioning tumors. Okay. أي سؤال عندكم اسألوا حتى أغير السلايد أو لا. Another causes including for hypopituitarism, including vascular causes like hemorrhage in aneurysm, intracranial aneurysm, or subarachnoid hemorrhage, especially related to ruptured perianeurysm. Pituitary apoplexy, that is hemorrhage into the pituitary, bleeding seen within the pituitary interstitium, and ischemic necrosis, hemorrhagic necrosis or pituitary necrosis and ischemia. And كل هاي الكوزز اللي احنا حكيناها tumor, bleeding, tumor, radiation, infection، هذه كلها كان anything causing pituitary necrosis and ischemia can result in hypopituitarism. Again, radiation can result in anterior pituitary damage, and infection, meningitis or meningoencephalitis, can propagate to involve the pituitary gland. Hypothalamic dysfunction, this will result in decrease in releasing hormone. هذا الهايبوثالاميك dysfunction شباب، هذا شنو نسميه؟ primary hypopituitarism or secondary hypopituitarism. Decrease in hypothalamic releasing hormone. Yes, exactly. It is related. No, it is not related to pituitary disorder. It is related to hypothalamic damage or tumor or so on. Okay. Signs and symptoms are apparent when about 75% of the pituitary gland or cells are non-functioning. And the symptoms, shabab, are varied according to the hormone affected. What do you expect the changes? What do you expect the hormone, the presentation in patient with decreased, for example, growth hormone in childhood? Yes, exactly. And what about TSH secretion or TSH or thyrotroph damage? What are the signs and symptoms? Pituitary thyrotroph damage, hypothyroidism. And what about ACTH or corticotroph damage? Cortisol deficiency, exactly. يعني loss of response to stress or infection and so on. And what about the FSH and LH that are gonadotroph damage? Yes, hypogonadism, loss of هذه الchanges الأخرى اللي هي infertility and loss of pubic hair and so on, amenorrhea in female. If the tumor press on the optic chiasm or optic nerve, or the result in visual disturbances or visual field defect, and also result in increased intracranial pressure, with all signs and symptoms of increased intracranial pressure, not only headache, nausea, vomiting, papilledema, and morning headache especially, the blurred vision, disturbed consciousness, even coma and seizures and convulsions. Okay. Sheehan's syndrome, this is the specific term related to postpartum hemorrhage, occur only after postpartum hemorrhage, bleeding after childbirth or after labor. The pituitary gland will enlarge in size during gestation. Gestation means pregnancy, and increase the activity. There will be increase in the activity of lactotrophs to secrete prolactin and stimulate mammary hyperplasia. Blood supply does not increase, and this will result in decrease in perfusion in labor, during labor, and in association with bleeding and blood loss and hypovolemic shock and hypotension. This will result in hypotension, generalized hypotension, and pituitary infarction and necrosis related to hypovolemic shock and hypotension, and diminished blood supply to the pituitary gland and infarction and necrosis. This is called Sheehan's syndrome. So signs and symptoms of pituitary dysfunction related to pituitary gland damage. Okay, about Sheehan's syndrome, postpartum necrosis, pituitary necrosis. Okay, pituitary apoplexy. Apoplexy, this is pituitary function impairment related to hemorrhage into the gland, bleeding into the gland. Blood will collect within the pituitary interstitium, result in swelling and infarction and loss of the pituitary function and compression on the surrounding structure. Pituitary apoplexy, bleeding, hemorrhage within the interstitium of the gland, result in swelling and infarction and loss of pituitary function. What are the risk factors? What are the factors behind or risk factors of patient at risk of pituitary apoplexy? Are patient with intracranial tumor. Intracranial tumor can result in pituitary bleeding, head trauma, neurosurgery, and also Sheehan's syndrome is bleeding or postpartum necrosis after severe hypovolemic shock. The complication, hypopituitarism, and the laboratory tests that confirm confirm hypopituitarism is decrease in all types of pituitary hormones and the target tissue hormones also. يعني شو نعني what we mean by that? The patient may develop hypothyroidism, that is secondary hypothyroidism, secondary to TSH loss. And the patient may develop hypogonadism or amenorrhea or develop a cortisol deficiency as a result of pituitary ACTH deficiency. Okay? So it is called here شباب شو نسميها هنا هذا target tissue hormone deficiency. It is called primary or secondary deficiency, like primary hyperthyroidism or secondary hypothyroidism, primary hypoadrenalism or secondary hypoadrenalism. Secondary because it is related to loss of stimulating or loss of stimulating hormones from the pituitary gland. So both of them, pituitary hormones are decreased in the serum and target hormones decreased. So ACTH secretion and cortisol are decreased, TSH is secreted, T3, T4 are also TSH is decreased, and also T3 and T4 secreted by the pituitary are also decreased by far. Okay, any question about hypopituitarism, Shabab? Okay. Hyperpituitarism, the opposite, disorder caused by pituitary hormone hypersecretion or excess secretion of pituitary hormones. The pituitary adenoma is the most common cause. خليها بالمقدمة دائما pituitary adenoma for any cause of hyperpituitarism. Genetic mutation can result with certain genetic mutations can occur and in which this mutation causing increased cell proliferation and increase the tumor secretion to their hormones. أشهر tumor, the most common one or the most frequent type of anterior pituitary adenoma, the most frequent type of anterior pituitary adenoma is called prolactinoma. Prolactinoma or prolactin secreting adenoma. Prolactin secreting adenoma. شنو الاسم الآخر إلها أحد سامع بيها؟ اسم الآخر للبرولactinoma. The most frequent type of pituitary adenoma, forming up to 30% of causes of hyperpituitarism, pituitary adenoma. The other name of prolactinoma, شو نسميها? Any idea? It is called, شو نسميها? acidotroph adenoma. Growth hormone or other type, or the second most common type of pituitary adenoma, the second most common type is growth hormone secreting adenoma. Growth hormone secreting adenoma. In adulthood, after the epiphyseal closure of bone, this result in acromegaly, whereas in before closure of the epiphyseal plate, it is called gigantism. Gigantism during childhood and before the epiphyseal plate closure. The ACTH producing adenoma، وش نسميها الاسم الآخر إلها شباب؟ Any idea؟ نفس الشيء. شو نسميها هنا؟ ACTH secreting adenoma. كورتيكوتروف. هنا نسميها لاكتوتروف أدينوما، هنا سوماتوتروف أدينوما، هنا نسميها كورتيكوتروف أدينوما. Result in Cushing syndrome. Here, the Cushing syndrome, شباب, is it primary or secondary? تسمعون شباب؟ لا. ACTH excess here, is it primary or secondary? راح صوت تسمعوني؟ طبعا secondary. أي شيء anything related to the pituitary, it is secondary. Okay, means there is excess ACTH secretion. ايش راح يسوي هذا ال ACTH secretion excess result؟ وين يشتغل على الادرينال cortex to secrete excess cortisol. This is secondary. Primary معناها it is within the cause, or the pathology is within the adrenal cortex. There are, as I say, genetic abnormalities in pituitary adenoma. G protein, the special protein called G protein, which is signal transduction from receptor to intracellular adenyl cyclase. The mutation in this gene result in that generate the second messenger cyclic AMP. Mutation in G protein results in repeated stimulation of cell proliferation, act on cell cycle. Hyperprolactinemia or hyperprolactinemia. This is a disorder can result from the most common type of anterior pituitary adenoma, that is the prolactinoma. It is caused by high blood level of prolactin. Another cause, any cause can result in hyperprolactinemia, shabab. Prolactinoma is the tumor secreting excess prolactin. Hyperprolactinemia is the excess or the clinical disorder caused by high level of blood prolactin. The most common cause is prolactin secretion by prolactin adenoma or lactotroph adenoma in the anterior pituitary. Any other cause? another clinical any excess prolactin in the blood can be seen in other setting, like what? Yes, pregnancy, and there are certain. So the most common cause is prolactinoma or lactotroph adenoma or prolactin secreting adenoma from the acidophils, or pregnancy. In pregnancy, there is excess prolactin release, and there are certain drugs that are inhibit or that like dopamine inhibitors, like reserpine, dopamine receptor antagonist, result in pituitary overproduction of prolactin. Certain drugs that are inhibit dopamine result in excess prolactin production. In male, the signs and symptoms are of hyperprolactinemia, مثل ما قلنا, prolactin secreting adenoma, pregnancy, and dopamine antagonist or dopamine inhibitors. Dopamine antagonist. So in male, the presentation in male is impaired genital activity or loss of sexual libido, hypogonadism and infertility, with overdevelopment of mammary glands or hyperplasia of breast tissue. It is called gynecomastia in male, whereas in female, there will be irregular menstrual cycle or even amenorrhea, that is lack of menstruation, or galactorrhea. What we mean by galactorrhea, that is spontaneous flow or secretion of breast milk, spontaneous in non-pregnant women, in acidophil adenoma, the anterior pituitary can secrete this excess hormone. So اكو فد term or فد statement تقول galactorrhea in non-pregnant women and is an acidophil adenoma of the anterior pituitary until proven otherwise. Galactorrhea in non-pregnant women is an acidophil adenoma of the anterior pituitary until proven otherwise. Look to these dots or milk dots. They indicate, each dot indicates hyperplastic lobule or lobe of breast tissue with excess spontaneous release and flow of breast milk in non-pregnant female. Visual impairment and headache and related to pressure on optic nerve. Okay, so again, pituitary tumors can result in hypopituitarism, hyperpituitarism, local mass effect, and visual impairment, and increase intracranial pressure. Laboratory tests: high serum prolactin, hyperprolactinemia, and the treatment is by dopamine agonist, that is bromocriptine, which will inhibit the release of prolactin. Dopamine agonist, because dopamine will inhibit the release of prolactin. Shabab, what do you think this picture about? This is about, as it is written, normal pituitary. And where is the pituitary here? أحد يدلني على البيتيوتري. Where is the pituitary? Where is the site of pituitary? Here, in this radiological imaging. شباب. This is the cerebellum. This is the brainstem. And these are the ventricles. This is the ventricle. نعم. Yeah. Yes, exactly. This is the sella torsica. This is the site of sella torsica, and this is the pituitary gland. So it is هيك يشبهوها شباب، يشبهوها Turkish saddle مثل السرج هذا Turkish saddle. This is يعني related to the sella torsica. Okay, and this is normal. هذا normal بنشوفه بالCT scan أو تشوفه another radiological image. This is normal pituitary glands localized or settle within the sella torsica cavity. Okay, whereas here شوفوا enlargement هذا نسميه enlargement in sella torsica related to pituitary adenoma. مو صحيح؟ The most common type of hyperpituitarism is pituitary adenoma. يا which type? Adenoma. And here هذا شو نسميه شباب؟ هنا نشوفوا who can find the adenoma here? Who can find the adenoma please? نفس السايت باعوها هذا السايت نفس اللوكيشن هذا اللي هنا السلة تورسيكا. شوفوا enlargement here. You can identify the enlargement here in sella torsica and distortion and pressure atrophy on the brain parenchyma. Here there is also obliteration and pressure on the ventricles. This is the corpus callosum, and here also there is obstruction, so there can result in increased intracranial pressure, hydrocephalus, and obstruction of the CSF flow. شباب ايش تعتقدون this type of adenoma? Is it functioning or non-functioning? What about this adenoma? Is it functioning or non-functioning? يعني على الأغلب non-functioning. Exactly. Why? Yes, because non-functioning tumors مثل ما حكينا قلنا non-functioning tumors usually presented late, usually presented with larger size than the functioning tumor. زين يعني الفانكشنينج تجي الفيميل عندها galactoria, تجي عندها امينوريا. الميل يعني يجي features of مثلا gynecomastia أو كذا. Whereas the non-secretory or non-functioning adenoma, there is no clinical symptoms are identified unless in advancing stage with features of increased intracranial pressure and pressure visual disturbances and visual field defect. Headache, nausea, vomiting, visual field defect. Okay. هذه picture, this is normal picture when normal patients see, and this is a condition called bitemporal hemianopsia. Bitemporal hemianopsia, that is the loss of lateral visual field, loss of the lateral. Only the medial side can be seen by the patient. It is related to what, شباب? What is the cause behind this blurred vision? شوفوا اكو blurring واكو loss. Exactly, adenoma affecting بعض شباب the adenoma here. شوفوا هسه. نعم. This is the common or the setting of bitemporal hemianopia. Bitemporal. So the lateral, there is loss of هذا البلاك معناها loss of lateral vision. Only the medial field can be seen. This is related to pressure here on the optic chiasm centrally. واحنا ما نتوقع انه التيومر grow in يعني symmetrical pattern. فمن يكون asymmetrical can causing another presentation or another field defects. يعني ممكن يكون to the lateral, to the left أو to the right أو يعني إذا هو central. Bitemporal hemianopia pressure is mainly central. If it is lateral here, like here, so the left side will be, so the right side will be lost here, and So according to the pressure induced by the tumor, whether it is central in the midline or lateral or to one field by adenoma. Microscopically شباب, how can you recognize the cells forming the adenoma? أول شيء أنتوا لازم من تشوفون هاي البيكتشر you should recall the normal pituitary gland histology. إذا تتذكروها اللي هي كانت mixed نسميها polymorphic acidophile basophile chromophore. صحيح؟ Here and in association with presence of reticulin network. How can you, in pituitary adenoma, that is the prolactinoma, acidophile adenoma or lactotroph adenoma, the cells are mainly acidophiles. You can identify acidophilic cytoplasm and also monomorphism. نسميها cellular monomorphism. كل السيلز هي acidophiles prolactin secreting. أو in somatotroph adenoma أيضا هي acidophiles. They are all acidophiles. So the first feature, the first feature is cellular monomorphism. And the second feature, so all the cells are uniform cells, uniform cells with bland-looking nuclei, and all are acidophiles. The another feature is what is loss or absence or paucity of reticulin network. مو مثل النورمال pituitary gland histology. There is reticulin network in between. Here, because the proliferating tumor, there is loss of reticulin network and vascularity. بعض هذه RBCs in between the cells. Vascularity is also a feature, another feature. First important feature is cellular monomorphism. All the cells are acidophiles, and the second is absence or loss of reticulin network and vascularity, rich vascularity. Another picture showed the uniform acidophile or pattern of the tumor, acidophile adenoma. شباب pituitary tumor اللي هي what are the قلنا prolactinoma or prolactin secreting growth hormone secreting or the less common ACTH secreting or thyrotroph secreting adenoma. They can be seen as incidental finding during autopsy. Incidental finding during autopsy. مرات يعني during autopsy خاصة هذه the small one اللي نسميها microadenoma. Sometimes it is classified into microadenoma. Microadenoma, if it is less than 1 centimeter across, less than 1 centimeter in diameter, or it is called macroadenoma when it is more than 1 centimeter in diameter. Here it is an incidental finding. شنو نقصد incidental finding شباب? Or called, sometimes it's called incidentaloma. What is incidental finding, please? واحد سوى له مثلا autopsy dissection for مثلا intracranial bleeding or sudden death. شافوا عنده مثلا intracranial bleeding and this is an incidental finding. هذه شافوها بالصدفة، لا هي مكتشفة ولا هي مسوية clinical features. مثل ما قلنا قد تكون هي growth hormone secreting adenoma أو قد تكون non-functioning adenoma in adults. So they are with no symptoms or can be with earlier symptoms. Incidental finding. من نقول incidental finding معناها they cause no clinical manifestation or clinical symptoms and discovered by incidental incidental investigation or autopsy. Microadenoma, where the tumor is less than 1 centimeter in diameter, and macroadenoma, with pressure symptoms, and here it can cause intracranial bleeding, intracranial hemorrhage, stroke, and death. Macroadenoma more than 1 centimeter in diameter. Again, remember the close proximity and close relationship of the adenoma. This is a pituitary adenoma pressing on the optic chiasm. This is the optic chiasm and optic nerve. This is the cerebellum, and this is the brain cortex. And so the patient, what do you expect the patient to present clinically? What are the manifestations of this mass lesion, please? Exactly. Yes. نعم. Yes, bleeding, intracranial pressure, obstruction of the CSF flow. طبعا هذا intracranial pressure with all its consequences, visual field defect, or if it is less than 1 centimeter microadenoma, it can be without effect, can be incidental finding, or can be presented if it is functioning, if it is prolactin secreting adenoma, can be associated with all features of hyperprolactinemia, or associated with, or it is growth hormone secreting features of gigantism or acromegaly, or, and also like if it is associated, شباب, if it is associated with, أو نسميها if it is corticotroph secreting adenoma. What are the clinical presentation? Corticotroph adenoma. What is the clinical presentation? Yes, hyperpigmentation. وبعد أكثر شيء most
Cushing syndrome.
Cushing, yes. It is called, which type of Cushing? Pituitary. Secondary, yes. أي شيء related to the pituitary, it is secondary, yes, exactly. Then, gigantism. Gigantism is growth hormone hypersecretion during childhood, before the epiphyseal growth, physeal plate closure, with resultant rapid excessive linear growth. يعني continuous growth, rapid excessive linear growth, gigantism. Excessive secretion, either secretion of growth hormone or growth hormone releasing hormone. Then, if it is associated with excessive secretion of growth hormone, it is called, شنو شباب, it is called what? Excessive secretion of growth hormone by the pituitary.
Secondary become
Primary. وهنا if there is excess growth hormone releasing hormone, هذا من الhypothalamus, so it is شنو? Secondary type. Okay. Pituitary hormone, which type of hormone? Causing gigantism in childhood before epiphyseal closure. Which type of tumor, of pituitary tumor? Somatotroph adenoma. Yes, growth hormone secreting adenoma. Or basophilic or acidophilic adenoma.
دكتور acidophilic.
Acidophilic, yes. Growth hormone. The acidophil secreting prolactin and growth hormone. Any idea about ectopic hormone? Can excessive ectopic hormone production can causing gigantism? شو تقولون؟ ممكن، مو صحيح؟ Carcinoid tumor or tumor outside the pituitary can secrete growth hormone, can result in أيضا هذا نسميه الectopic hormone secretion. The complication is including hypertension in childhood, osteoarthritis, and insulin resistance. The height signs symptoms. The height is above the standard deviation, also obesity, and overgrowth of face and extremities, headache, and maxilla and mandible protrusion. Gigantism. This is a picture showed you the tallest ever man in the world, and so and involved by affected by gigantism. Acromegaly. So here the tumor or the excess growth hormone release has occurred before epiphyseal closure during childhood. So there is linear excessive growth of bone, muscle, and soft tissue. Acromegaly is growth hormone hypersecretion in adulthood after epiphyseal closure, lead to enlargement. No increase in length more than, but there is an elongation or enlargement of the extremities and face, most commonly related to pituitary adenoma secreting excess growth hormone, somatotroph adenoma, or non-pituitary tumor and from the ectopic pituitary, like in pancreas, from the lung, adrenal gland. Usually they are benign tumor because the manifestation can to evolve need a time. That are these adrenal gland, lung, and pancreas can produce ectopic growth hormone. Adenoma secreting growth hormone, and in adult, again, epiphyseal plate are closed, increase in connective tissue proliferation and bony proliferation, and growth hormone excess will result in insulin, impaired insulin sensitivity in tissues, and that is result in insulin resistance, increase in gluconeogenesis and glycolysis and lipolysis. Growth hormone play important physiological effect for glucose metabolism directly by gluconeogenesis and glycogenolysis and lipolysis, and indirectly by stimulating hepatic release or production of insulin like growth factor 1, which will facilitate the insulin action and result in so increase hepatic gluconeogenesis, increase glucose production by the liver. Also, lipolysis by the growth hormone result in increase in free fatty acid from adipose tissue. Free fatty acid production from the adipose tissue result in gluconeogenesis and development of insulin resistance. So excess growth hormone result in hyperglycemia by increase glucose production by these mechanisms, gluconeogenesis, glycogenolysis, and lipolysis, and decrease the peripheral glucose use by the tissue. This is the diagram showed you the effect of growth hormone on the adipose tissue. It will decrease the glucose, is the pathophysiology behind hyperglycemia and insulin resistance, decrease the glucose uptake in peripheral tissue and increase lipolysis, result in increase in free fatty acid. So the patient have increased incidence of hypertension, increased incidence of cerebrovascular accidents, and increase on the liver. This growth hormone will stimulate the hepatic production of insulin like growth factor 1, which will increase the glucose, which will inhibit the glucose uptake, and so increase in gluconeogenesis, increase glycogenolysis, and also which will result in hyperglycemia. And the muscle, there will be decreased glucose uptake, and consumption of glucose by the muscle, and increase glycogenolysis, result in hyperglycemia. There will be an enhancement of insulin resistance. So insulin resistance means impairment or poor sensitivity of the peripheral tissue, the muscle, adipose tissue, to the effect of insulin, result in hyperglycemia. The complication, there will be abnormal glucose tolerance test and type 2 diabetes and increase in blood pressure and also respiratory problem. Signs and symptoms of acromegaly: soft tissue and bone swelling, hand and feet abnormalities, يسموها sausage shape or swelling of the fingers. Swelling of the finger or sausage-shaped fingers because of accumulation of soft. ألو نعم تفضل قول احكي. Swelling of the fingers or called sausage shape or enlargement due to enlargement of soft tissue. The hand and feet, the skull and jaw, in the skull abnormalities, jaw protrusion and increase in teeth spacing, forehead protrusion, brow protrusion, and organomegaly. The heart, the kidney are enlarged. The vocal cord sometimes are enlarged and result in slow, deep voice. Excessive sweating is also a feature. And joint pain, arthritis, and arthralgia, and thick skin. So protrusion of the jaw and protrusion of the eyebrow and forehead with accumulation of soft tissue enlargement and bone enlargement compared to normal patients. The other type or less common type, about 25% to 20 to 25% of pituitary tumors are non-functioning. In the shabab, non-functioning mean non-secretory or tumors with no clinical signs and symptoms of excess hormone release or production. They are come in attention due to local mass effect after enlargement or after significant enlargement in size, with pressure symptom, with features of increased intracranial pressure, visual field abnormalities, headache, and hypofunction of one of the target endocrine glands. شباب هذه هنا hypofunction of one of the target endocrine gland. هذه هنا شو نسميها؟ نقول hypoadrenalism, hypothyroidism, لو hyperadrenalism, hyperthyroidism. شو تقولون؟ Hypothyroidism, hypopituitarism, exactly. because they are because the stimulatory hormones by the stimulating hormones from the corticotroph or hormones or thyrotroph hormones are suppressed or decreased, result in secondary hypothyroidism and secondary hypoadrenalism or secondary hypogonadism and so on. So they are called non-secretory adenoma or non-functioning adenoma. They are discovered, so both the target hormones and the pituitary hormones are lowered within the serum. What do you expect this type of adenoma? Is it functioning or non-functioning, Shabab? Again, what is the type of this tumor do you expect? Non-functioning. What is the common presentation, Binti? What is the common clinical manifestation or presentation of this tumor? هي أدينوما طبعا أدينوما كارسينوما ايش تعتقديها common لو يعني rare carcinoma is rare in endocrine gland and pituitary adenoma قلنا احنا most common yes وشنو what is the clinical presentation, what is the clinical manifestation of this tumor, of this enlarging tumor? شلون yes yes بقى احنا هنا هو شو مسوي هنا التيومر بقى شلون نسوي deformity of the cerebral cortex ممكن يسوي cerebral infarction ممكن يسوي sudden death there is obliteration and derangement and deviation of the midline, obstruction of the cerebral ventricles, the obstruction to the flow of CSF, foci of bleeding hemorrhages or spotty hemorrhages. Otherwise the tumor is شو تشوفوا هذا التيومر benign or malignant شلون شكله؟ لا مو malignant باو اشوفه
benign التيومر adenoma والكبسوليتد
وعلى البوردر شلون هي well demarcated not infiltrative وشوفوا large size يعني هو واصل هيك large size وهو لحد الآن هو يعني ما مسوي ذيك الكلينيكال برزنتيشن ممكن يعني sudden death can result from cerebral infarction after enlarging size, pressure symptoms or increased intracranial pressure. So this is an advanced pituitary adenoma. It is enlarging beyond the boundaries of sella torsica, distorting the left lateral ventricle and even deviation of this midline and pressure atrophy. So pressure atrophy on the cerebral cortex. The patient can be presented with wide range of clinical manifestation, from the visual abnormalities, visual field defect, coma, loss of consciousness, disturbed consciousness, convulsions, seizures, and according to the side effect, even if it can press on vital centers, can be presented with مثلا respiratory failure or sudden death and so on. So it is called non-functioning. What is the tumor, Shabab? What is the kind of pituitary tumor behind this type of lesion, behind this lesion, behind this disorder? What is the kind, what is the type of tumor? أول شيء دقيقة أول شيء هو شنو هذا what is the disorder here شنو هذا spot diagnosis يلا this is a spot diagnosis what is the clinical syndrome هذا شنو ايش تشوفون moon faces buffalo hump and striae abdominal striae هذه شنو من شايفيها وين يعني ممكن this is a syndrome called
Cushing syndrome.
Cushing syndrome. Yes, Cushing syndrome. Cushing syndrome. اسمش من فضلك ماما.
هديل لبيب.
هديل. Cushing syndrome. Is it primary here, or is it, can you differentiate between primary or secondary from these pictures, or not?
secondary.
شلون عرفتي secondary؟
نتيجة نقصان الأدرينوكورتيكوتروبيك هرمونز.
هسه دا أسأل سؤال واضح. هذه البيكتشرز can this picture differentiate between primary or secondary Cushing syndrome? أنا أقول ماكو differentiation، يعني ما ممكن هذه في female أو هذا الميل ماخذين excess prednisolone for any مثلا autoimmune disease or مثلا أي for any cause وصاير عندهم هذا الكوشينج syndrome اللي هو most common cause. مو صحيح؟ most common cause of Cushing syndrome هو most common cause of Cushing syndrome هو يعني excess administration. بعدين تجي وراها ACTH overproduction اللي هي الcorticotropic secreting adenoma اللي هي secondary to pituitary enlargement or secondary to pituitary hyper يعني pituitary secretory adenoma. الكوشينج syndrome هي كلها نفس الفيتشرز، هي مون فيسيز، هذه البافلو همب والابدومينال ستراي والدايابيتس والهايبرتنشن والبيجمنتيشن، هذه كلها نفس الشيء، كلها كوشينج. relate to excess ACTH level within the blood, whether it is primary from adrenal hyperplasia or secondary from pituitary secreting adenoma, ACTH secreting pituitary adenoma, or from excess administration. ومن الcommon هسه قلنا من the most common cause. What is the most common cause of cortisol excess or Cushing? Yes, exactly. 90%, 90% of increase in cortisol level who are related to exogenous administration of cortisol or of corticosteroid. هذا الabuse of steroid abuse. Then this is the most common cause. وبعدين هاي تجي الكوزز الأخرى اللي وراها اللي هي secondary و primary to either to adrenal cortex or to pituitary excess ACTH stimulation. So if it is هسه خلينا احنا بالpituitary لحد الآن مو صحيح. If it is related to ACTH even though it is قلنا rare مو صحيح not common like the exogenous administration, what is the kind if it is secondary to if it is secondary to pituitary ACTH excess, what is the kind of cell of pituitary gland responsible for this abnormality or might be proliferated in this abnormality? What is the type of cells?
الكورتيكوتروف.
The type of cell a corticotroph ايش نسميها؟
هو كورتيكوتروف أدينوم.
اي acidophil or basophil? Basophil, yes, basophil adenoma, exactly. زين؟ okay. So basophil adenoma. Any question till now؟ أنا صراحة أدز لكم رابط مع الحضور شباب.
دكتورة بس السؤال إذا تسمحين.
تفضل.
دكتورة هو بداية المحاضرة دكتورة الفرق بين الأبوبلكسي والهيومرج يعني نورمال هيومرج دكتورة شنو الفرق اللي بيناتهم؟
Pituitary apoplexy is many causes can result in pituitary apoplexy. هذه هي pituitary apoplexy. Hemorrhage within the gland. Blood will collect within the gland, within the interstitium. من يصير blood within the interstitium, collection of blood or hemorrhage or RBCs within the interstitium. مش حيصير؟ يصير swelling, يصير infarction, يصير hemorrhagic infarction within the gland. This will result in loss of pituitary function. وشنو الcauses? Many causes. مثلا pituitary brain tumor, intracranial head trauma to the head, surgery, جراحة, أي neurosurgery, bleeding يصير within the parenchyma of pituitary gland can result in loss of pituitary function. Or another intracranial tumor, or it can be related to Sheehan's syndrome. Sheehan's syndrome is necrosis or after postpartum hemorrhage, نسميه postpartum hemorrhage necrosis after hypovolemic shock, and after enlargement of the gland, هذاك Sheehan's syndrome, enlargement of the gland, and secondary to prolactin stimulation or prolactin excess during gestation, during pregnancy, without increase in blood flow. So there will be enlargement with associated bleeding and hypovolemia and hypovolemic shock or in childbirth, associated with childbirth, result in shock and necrosis in female after labor with features of necrosis of the pituitary gland. هذول ينطوهم replacement therapy after necrosis. اوكي ابني.
تمام شكرا دكتورة.
نعم دقيقة. إذا أعطيكم رابط الحضور، لا لحظة تسجلون. شباب هذا جوجل فورم، بس سجلوا حضوركم.